We are back, mere mortals. It is I1. We have Karen on the other side of this table.
Hello,
and we are
hello.
talking about pain.
Ah.
Pain indeed. Episode 58. No? Jeez. I'm not even going to call that episodes
Yeah, I'll
anymore.
do it now. From
Yeah,
now on.
you can keep track of these ones. But we're talking about pain today in our themed podcast. As always, though, the immortal moment of the week. Karen, hit us up.
Okay, deep chats with friends are always valuable. So we had one just recently on Friday. And yeah, I think you can gain knowledge from those that you might not particularly think about beforehand, or you think you're doing something and then realize talking to others that like, oh, no, not really. So one thing I got of this was, I'm spending a lot of time with my family and I think I got my priorities straight, but I haven't been particularly asking them like how they're going, what's their mental state, how
Was it you asking your family members?
yeah. And I don't think I would have got that insight unless I had been talking, with you guys in a room. We had some drinks and stuff, but we got, pretty deep at the end when we were all asking each other, what do we want to do this year? What do we want to accomplish? So that was my little insight there.
Nice. Yeah, I felt that too because I followed up the day afterwards with catching up with my sister, and I was already planning on doing that. But then I was able to do it in a much deeper way from that conversation, which is really good, and I enjoyed it. Mine comes a little bit more in touch with the topic we're going to talk about today, pain. I got a needle this week.
Oh,
And I am someone who hates
he
needles.
hates them.
The pain level would be like, if you scale it out of 10, probably like a 1, really, realistically. But to me, I don't know, just mentally, the pain, I'm just like, oh, this is going to be like the most horrific thing ever. So obviously it wasn't. And during it, I was able to just kind of focus on something else because I was busy doing other stuff. And I kind of just got through it and I was like, oh, that was totally fine. Which, we'll get into it probably today, but that mere mortal moment was, I've always considered it to be a very painful thing, both mentally and physically. But when my mind was just elsewhere thinking about other things, it just became almost nothing. So
Yeah.
Maybe it's a little insight into as we talk about pain today.
Yeah, and that was not even the drawing blood one. That was
just purely just an injection. Yeah.
A tetanus shot.
Yeah,
So
the
there you
simplest
go.
of them all, but yeah, they're very interesting.
All right, kicking off with the definitions.
Hit me.
So this time I actually did do it. I've been doing the etymology for the past while, but it was pretty boring, this one. So I was like, you know what? I'm not going to even waste my time on this. So for me, this seemed to make the most sense. Unpleasant physical sensation conveyed by the sensory neurons. And it seems to be like a little bit muddled with emotional pain as well when you talk about that. And even just the way we use the word pain. So you can say, they took great pains to do something.
Yep.
That doesn't really involve pain at all in the sense of a sensory neuron
It was like
conveying
more effort.
information. Yeah, that's effort. Or he's a pain in the ass. That's like, oh no, that's more of an annoyance. So I think it's one of those words that does get used a lot and not in the probably like traditional sense that it should be, but it is useful to use it in other ways as well.
Yeah. Well, when I was going to talk about it today with you was whether we're going to go down the path of pain in the physical sense and the emotional sense as well. The variances between them, the difference between pain and suffering.
Yep. Yeah, that's a good one.
But my definition, what I was finding was very physical. So it was highly unpleasant physical sensation caused by illness or injury, caused mental or physical pain to something. But yeah, I think there's that side of pain where it's like the actual scientific, this is what causes pain in a scientific way, from a nerve endings, how it sort of progresses up to your brain and your brain creates a signal that says, hey, painful, take your hand off the stove. That sort of pain. Where you can have pains that are not like that, but you still describe them as a pain, saying the loss of a loved one. You say that, oh, that's painful. It's painful.
Yeah.
But it's not a physical sensation that you're feeling, but it is potentially chemical reactions within you that's causing the feeling of pain. And then you have other types of pain, which are even more unfathomable to kind of explain. So imagine the pain of, seeing someone else get hurt. Not to the point of like dying, just getting hurt, and even you can feel like phantom pain from that.
Yeah.
Or I think there's the example of like phantom limb pain when you don't have that limb, but you kind of feel like there's pain in it. So yeah, lots of variations. I I think it would be an interesting discussion between the mental side of it and the actual scientific side of it. So
For sure.
I want to start it off with let's go personal here. What is the worst pain you've experienced personally from a physical perspective and mental pain perspective? If you could explain it that way.
I had to think about this, and
It was hard to think about this.
yeah, for sure.
Yeah.
I feel like it's one of those ones that goes away pretty quickly. Like once it's in the past, it's
recall.
not super there. Like painful. Geez, man. Like I'm sort of starting to think. There was I mentioned it once before, but in Cartagena, I got very sick on a boat ride, and I was coming back. That was hard because I'm not sure if it was pain per se. It was just I was very, very uncomfortable and like feeling very ill, but I wouldn't know if I would call that painful per se. It was just because when I think of pain, I definitely think of more of the acute like blast of just something of whatever it is, where it's just so unbearable that you need to do something to get rid of it. I've never had that. I've never needed to have drugs to manage pain. Panadol, I've never found it even works for me. For me, it's more like a whatever. So I would say, like, if I had to say like physical pain, it would probably be either that real uncomfortable sensation I had, even though I'm not particularly sure on that, or like doing something like yoga where I would just have to put myself in some sort of position and just try to hold it for a long, long time. That was extremely painful. And that was where I was like clenching fists, like breathing hard, just trying to get through it. So if I had to say, it would be one of those two.
Now that you recall that, and it's interesting because we probably haven't had any really big injuries in our life that we can be like, oh yeah, no, that was painful.
You seeing this, man? You seeing this finger?
But you're saying that it was more painful to do yoga than that. Right?
This didn't really hurt.
No, I think for me, I was saying it's probably just like I can remember two instances of getting cramps. One from soccer, like a post-game soccer, and another one when I was like swimming, where I had to like drag myself out of the swimming pool, but my legs like were not moving. And I was, to me, if I can recall it, it was really painful. But hearing you talk, I've also had a massage done by someone who was like a super deep tissue massage, and it was like as hard as possible. And I swear that's one of the most painful things as well that I've sort of endured. But, that's like such a low level really when you compare it to like potential pain, like having your arm chopped off or something like that. What about mentally?
Mentally, I think it would be when I've done something wrong and felt super guilty about it and just let myself sort of be consumed in the guilt in sort of, I guess, that essence of like you're a piece of shit. That's like the worst thing you've ever done sort of thing. I think probably that, I'm fortunate I haven't had someone really close to me pass away. I've had grandparents pass away, but they live in New Zealand or Sydney or quite far away. So I'm
apart from that.
I just wasn't emotionally close to them or physically close to them as well. So I've been very lucky in that sense. So I don't have a loss or grief sense. I would probably say something like that, where it's just that internal self-judgment getting to such a peak where it's like, just very, very unpleasant.
Yeah, no, mine, this is the story. I'll put you in the position. So I'm driving in my Mitsubishi Lancer ES Blue Limited Edition back in the day. I've got a scheduled trip to the US. I think it was 3 months away. And I'd been saving like all the money I could have for that trip, because the particular trip we had planned was going to be around like $10,000, something in that order. And this is back when I was younger, so that was like a huge amount of money for me. So that was going down, and I was driving. I was turning left at this particular intersection. I looked around. There wasn't a car coming, so I kind of accelerated. And I turned back around, and the car that was in front of me didn't go. And so I ended up like just going up the back of him. Now, unfortunately, my insurance didn't end up covering that. And it was like I had to pay for that person's like insurance, for the car fix, my car fix. And like during that time as well, I just think I was just like in a very down state. And like that combined with the fact that I'm like, oh, now I've got to pay money to like fix my car up. And also all this, I think I can recall specifically like that day I was like, oh, this is just so painful emotionally. Looking back at it now, it doesn't feel like much, but I remember like that specific moment, I was like, oh man, this is like, that's it. It's over. Like this is the worst thing that could have possibly happened.
How old were you when that happened?
Would have been, I think 22, 21 or 22, which at the time it's obviously like a huge thing. Now it obviously isn't, but in the context of it, it just felt like a massive thing.
Yeah.
So we talked about those two things, right? And we described a couple of things. And then this is where I want to... So we defined a little bit of pain, where it's like unpleasant physical sensation, your neurons or the actual, you smash your hand on this table and like you feel the pain. How would you try to differentiate? Because there's a whole saying of pain is mandatory, right? So pain is the thing that you have to experience. Like we all experience it, that's the thing.
Yeah.
But suffering is optional.
Yeah.
Right? So suffering is sort of like the mental choice to then suffer because of that pain. Do you think in that emotional pain, it's really pain or it's more just suffering? It's your decision to feel that way.
Yeah, I'd say it's hard to say like your decision, because sometimes that stuff really creeps up on you.
Yeah.
And even if you're, say the most in control person, the most practiced meditator in the world, you're still going to potentially lose track of what's what, and it'll jump up on you.
Yep.
So I wouldn't be saying, casting judgment, saying this is something you should be able to control, because it's good if you can control it. But yeah, I probably would say emotional pain is that suffering caused through, thinking about something or being in a state where your thoughts potentially amplify things that you're feeling in your body. So one of the things I was reading was, say you go through some sort of traumatic event, nothing physically has happened to you.
Yep.
But your mind works itself into such a state that you start feeling stressed, and then your body will internally clamp up, and then you'll start feeling things differently.
Yep.
And then you will get those neurons firing in different ways. But yeah, so if we had to say, I'd say 99% of emotional pain is the way you think about things, the suffering.
Yeah.
Yeah.
Well, that's what I was going to get to. I was going to say, physical pain, obviously the thing, because it's a direct creation of nerves endings being burnt or something, and it goes to your brain, and okay, you need to stop doing that. That's fine. But I think all emotional pain probably isn't correctly described. I think emotional pain is more it's you suffering, which then induces some sort of pain within your system because of you're stressing yourself out, and then you feel pain because of it. But it was your suffering that actually induces that first. Yeah. Not to say that, as you say, not everyone can, there's a lot of people out there who wouldn't be able to control it. But the thing is, you can. There is an option for you to control it and not let it get to you like that. But, as humans, that's very, 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 very rare. And if you do it, you almost have something wrong with you to the point that you can't feel that. So I would have... Now, moving forward, I think I'll consider that much more as suffering as opposed to pain. So I'll consider it much more as okay, well, as opposed to pain where it's it happens. It is going to happen for sure. You can choose to suffer because of a lot of things. So with death of, say, family members, you can choose to grieve for a certain amount of time. And sometimes, you can't choose that. You just have to, say. Yeah. But then you can choose to how much of that pain sort of lingers for you. So you can choose to be really deeply concerned about it and feel painful about it for a very long time, or you can make that mental decision to not. That's it's entirely your decision. Not to say that you should or shouldn't, but it is a choice as opposed to pain when it isn't a choice. So you can't choose not to feel pain. Yeah. You can't if you put your hand in the fire, you can't choose not to feel it unless you don't feel pain at all. Which is an interesting thing. I don't know if you ended up looking into it. I think it was called the congenital insensitivity to pain. CIP.
I know of it, but I didn't look it up.
Congenital analgesia, one of the more rare conditions which a person cannot feel and has never felt physical pain, right? But looking into it, it didn't say anything about emotional pain. So they can actually feel emotional pain. It's a thing that so you can experience emotional, but they can't experience physical pain. That's what, for me, it makes me think even more okay, well, that's not even really pain then, it's much more suffering. It's you choose to feel that. They can't feel pain.
Yeah, it's something different.
It's that they feel emotional because you're choosing to feel it.
Yeah, I think talking about suffering, it's easiest to talk it with physical pain and not so solely just say a family member dying. So I'll give a quick example for my finger, right? So the actual pain of this is relatively small. So when I first did it, it sort of felt like I'd been whacked in the hand with a ruler. That's, that level equivalent of pain. That sort of subsided, and then it was swollen for a bit and still painful to move, but not an excruciating sense. I can still clench my fist, and it's more like, I guess, like the pain you'd feel from like stubbing a toe lightly against a block or something. And then when I straighten it out, it's fine.
Yep.
So like physical pain wise, this really hasn't been that much for me. But the emotional side of it was, this is going to stop me from doing what I want. So I can't do my handstands anymore. So I can't do, potentially it's going to be stiff and feel this way forever. So more adding the long-term stuff on this, like, I might have damaged my finger forever. I might not ever be able to use it exactly the way I want to. And all of that is the emotional suffering attached to that.
Yep.
So physical pain-wise, relatively small, but the additional stuff put on top, worrying about the future, worrying about not being able to do the things exactly I want to do, that's like the suffering side of it. And so one of the things I've heard is quite effective, and I've used it sometimes to some effect, is meditation. And so if you focus just on the pain, and they've done studies with people who have chronic, serious, long-term pain. So they've got a displaced disc in their back or something, which is just it's firing on that nerve, and it's just pressing on the nerve all the time.
Yeah.
So there is just a constant, dull, maybe even not dull, maybe very acute pain that's just going through their system the whole time. And what they found was, doing these tests where they'd get people to meditate on it, even like 6 to 12 weeks of meditation.
Yeah.
If and focusing just on the pain. So you'd think that would maybe even amplify it, because you're putting all your attention on it now. But if you do it in a way where it's like, look, I'm just trying to understand what this feels like, not attaching thinking about the past, thinking about the future, just what is this present moment? What is this feeling? And that reduces the amount of pain. I don't think it reduced the amount of physical pain, but it reduced the suffering pain. So that's a good method for getting rid of the suffering component, at least to it.
And I guess we're not going all the way down to suffering in this particular. I want to focus on pain. So I guess it helps describe it that pain is the actual construct of like what is happening of painfulness, but as you like what you're sort of saying is like more like the human construct of just creating pain out of or suffering that then feels over the top of something. I got a question for you, but I was going to say, in terms of like pain, what types of pain it actually described as pain as opposed to suffering. The things like acute pain, chronic pain, phantom pain, psychogenic pain. Have you heard of that before?
Not that one, no.
So this is one interesting. So it's also called psychalgia. It's essentially like a physical pain that is caused, increased, or prolonged by mental, emotional, or behavioral factors.
Okay.
So psychogenic pain is like when you have a headache or a back pain or stomach pain, and then you just hold it for a long time, and it just increases to become like, oh, that's actual pain. So it goes from like something that you'd be whatever to like more painfulness through it, and that's not. I think that's defines the actual changes chemically in your body, where it's not just you're thinking about it. It's like, oh, this is changing something within your body. Like if your stomach messes up and it messes up other parts of your system, then your body hurts and then you're in actual pain. So there's a couple of descriptions there. From a pain, so we're talking pain perspective, do you think that if we were in a world where no one felt any pain, so like almost if everyone had congenital insensitivity to pain, do you think that would prove for a better world?
No.
Or a worse world?
No.
Worse?
Worse.
Why?
For sure. Just because the way we've evolved, and I'm assuming right now you're saying like straight from right now?
Yeah, straight from right now. Yeah. No pain. I'm holding on to like a boiling cup of water.
Yeah. No, just the way we've evolved, evolutionary speaking, we need it. I think there's, maybe if from the very start, so like from the very, microorganisms we came from, if there was no path for that signal to get through, say like that was always blocked, maybe, and we evolved to this state, maybe, but I think the world would be a very different place.
In what way though?
Unimaginably different. Like I don't even think, like, let's take for example death. I'm not sure we'd really try and avoid death as much. So because the things we do that are painful usually lead us away from doing something that's going to kill us.
Yeah.
Granted, it's a little bit different for like, falling off a cliff, for example, or things like that. But yeah, I can't see a way that it would be a better place.
Yeah.
What about you?
No, I think the construct would be so different that we can't just really explain it. Like you're talking about death. You'd almost be like almost nonchalant about death to a point because there is no pain associated with it. Like some of the pain that could be, something's hurting and you're like, oh, maybe I'm going to like die because my arm's chopped off or something. And there wasn't that at all. There was not even a place in your mind for that to happen. You kind of just be like, oh, well, yeah, cool. Person's dead. There's no pain associated with it, even that to lead to suffering. But this is why it's so hard to explain. Do you think you can have suffering without pain?
Yeah, for sure.
Yeah?
Yeah.
How would you have that? How would you have suffering without pain?
A loved one die.
But
we just talked about that.
Sure, but that's still, there's pain within you. Like there's pain from, do you think that you suffer, but from the suffering, it can create like chemical imbalance in your body to be in pain?
Well,
or just be on its own?
This is where I think we're maybe talking at cross purposes. For me, pain was the physical neurons firing and hitting somewhere. I'm thinking more bodily pain.
Okay, then you can have a separate.
Yeah, I definitely see them as separate. One thing that just came into my mind was we might even get the chance to see this in our lifetime. So say VR gets really good, right?
Yep.
And it becomes visually indistinguishable. You can't tell what's different. Obviously, the noises, we'll be able to mimic that pretty easily. I think we're already at that level. And say we have haptic bodysuits as well that you put on. So when something happens in the world that you're in, so you're in a jungle and you brush past a branch,
you can feel it sort of.
You're in your living room,
body.
but you'll feel like the tingling sensation on your hands and whatnot.
Yep.
Say in that world, you don't have the ability to connect the pain that you would feel in that world to your brain, which is pretty much what you'd have if you had a haptic bodysuit. You'd maybe feel things, but I doubt they'd design it to feel like if you got your arm chopped off in that world, you'd feel that. I don't think you'd be able to feel that same thing because the suit's only on the outside, obviously.
Yep.
And there's internal stuff that you'd feel.
Yeah.
So in that, I think we'd be able to potentially see like what it is like to live without pain. And I'm just imagining that people just do stupid shit in that world.
Oh yeah.
Like I just don't see how that would, it would be fun for sure for maybe like the first 100 times.
Yeah.
And then it would become like a game of some sort. Like it wouldn't.
You'd become way more reckless, I think.
Yeah, exactly.
Like the ability to think like, reason like, maybe I won't do that because of pain would just go away.
Maybe
whatever.
Yeah, maybe I can make that jump across that pool. Maybe I can whatever.
And even if I don't, it's fine. Like it's okay.
Yeah. So that's potentially one thing where we might be able to see in our own lifetime what it would be like to live without pain.
I think, and I flipped the question where I think whether pain, a world without pain or not is better. Well, I think we decided no, it isn't better. I actually think it's probably better in a world where we experience pain more.
Okay.
So a world where we experience pain more, I think would be, I'd just say, it would be better. Why? I think you'd just be even more cautious with a lot of things. So like if you truly shouldn't be doing something that's going to put your life at risk, just like as a human, as a civilization, the more you're susceptible to the pain of it, then probably the less you're going to go down the path of experiencing it. So I don't know if a broken leg was like 100 times more painful than what it really was, maybe you'd really, really try not to break your leg.
Yeah. Okay. But then with that same reasoning, a stubbed toe would feel like a broken leg. So how would
that'd be pretty crazy.
How would that like fit into your system? Because then you're gonna be walking. You like to be fast, man. You would be forced to be slow. You wouldn't be able to like going up a set of stairs would become something that requires 100% concentration. You can't mess that up, man. You want to feel what a broken leg would be like.
I think it's just
once a day.
If it was like that across society, across like evolution, then I think we just have a society that's a little bit more safe. I guess if you just in general just be safe, like everyone would be slower and whatnot, but you'd have a much safer society, I guess.
Yeah, well, safe in one sense, but that's discounting other things. So I doubt we'd have sports, for example. So you like sports, well, that's probably not going to exist.
Yeah.
Because every time someone gets hurt, like, they're just going to be an absolute ridiculous agony. I don't think people would do that. So you'd maybe have a more safe society, but you might not have an interesting society. You might not have a society even worth living in. By default, I'd probably say that whatever evolution gave us at the moment with regards to pain is probably about the right level that we need. But
Well, it's all that we know as well, right?
yeah, exactly. It's coming out with these hypotheticals is difficult.
It's hard, within the context of our own understanding. One thing I was going to bring up was I was going down the path of, because sometimes explaining pain is difficult, especially when like you don't know what someone else feels. You're talking about, you experience pain, like you stub your toe. To someone that might be, like it feels like a 2 out of 10. To someone else, it's like, it's ridiculously high in the pain threshold.
Yeah.
And I think that pain threshold is it's an interesting concept to figure out like what actually it entails. So I pulled up like the pain level scale to see what it was, and to be like, okay, what's the highest pain that you've really felt? So to be like, okay, could you really, what would be a threshold of like, okay, I'd be okay with feeling this, and what would be the point where you don't? So I'll read out a couple, right? So pain level of 1 means it's like very lightly, barely noticeable pain, like a mosquito bite.
Yep.
So that's sort of a pain level of 1. You get a mosquito bite. I don't know if I've even felt a mosquito bite before. I don't know that was painful. So I was like, okay, this is cool. Most of the time you never think about this pain. That's kind of what they were talking about. But going all the way down.
What's a 6?
So level 6 is an intense pain that is strong, deep, and piercing. So strong that it seems to partially dominate your senses, causing you to think somewhat unclearly. At this point, you begin to have trouble holding a job or maintaining normal societal relationships, comparable to a bad non-migraine headache combined with several bee stings or a bad back pain.
I like the combo there.
Yeah, gee, I like their examples. Very cool.
I'm not sure I've experienced that.
Well, I was going to say, I was like, a pain level of 6 it almost seems a little bit like a continuous pain as opposed to like a sharp, intense pain.
Yeah. But
I was like, I don't think I've even experienced pain level 6 at all. 5 is distressing, strong, deep, piercing pain. I'm like, okay, well, I've like a sprained ankle when you stand on a wrong or mild back pain. I'm like, okay, that's the sort of stuff that I've felt. But it goes beyond when you go to like a level 8 or a level 9 that I'm like, okay, this is like when it'd be like if someone was explaining to me that they were in excruciating pain or like really, really bad pain in the 8 or 9. That's where, because I've never experienced it before, like I couldn't even begin to fathom what that feels like. And that's where it can become dangerous, I reckon, when people say like, if you do this, go and do that. Because you're not really truly aware of like a pain level of what someone might be in. And, maybe someone's 5 is a level 7. And I reckon it could be dangerous to be like, no, it's fine. Just continue doing it. And you're like in some really bad pain level because of it. I was trying to figure out, okay, what's the pain level that this ranking says to where it's like, okay, it's like unbearable. What's the actual threshold, like human threshold of it? But even pain level 9 is excruciating, so intense you cannot tolerate it, and demand painkillers or surgery no matter what the side effect risk is.
Yeah. Where
level 10 is, you're almost like, you're in an unimaginable pain. You're about to like pass out unconscious because of it.
Yeah.
So when it gets to like the 9s and 10s where you're pretty much about to pass out because your body's like shutting itself down, then it's like, okay, that's some pretty ridiculous pain. I was trying to think, can you go beyond a level 10 pain though? Can you go something beyond where your body's like shutting down and going complete? Like so acute that it's like, okay, you're like, your body's like, oh no, I've got to die now.
I think people have tried. So people torturing other people, for example, and say you're, in the past there have been, master torturers who have mastered, I guess, both psychology and the physical realm, so that they know how to get like the most out of their patients or whatever, their victims.
Like how much they can keep them alive for or something.
Yeah. And so, I mean, it's an interesting question. I would say maybe someone once has felt an 11 where like some total sadist has managed to like inject them with more like not morphine, adrenaline, so that they stay awake while they're
doing something.
So like they go past that point where their body would normally shut off.
Yep.
And then it's like, no, you keep feeling this potentially. I don't know. For me, it sort of seems like I like a 1 to 10 scale. So 10 would be like,
that's it. That's absolutely max.
You can't go beyond that. But imagine your world where a 10 now becomes like a 20. It's like, I'm not sure. Yeah, I don't even know if that makes sense.
The thing though, it's like I was saying, what you can feel or what you compare it. So like I look at it and I'm like, oh, pain level 5, 6. I can kind of understand what that pain is when we're talking to people. But if someone broke their leg or something and it was what is considered, say, a 7 or an 8, you almost can't converse about it because you just don't. You cannot understand what that feels like. And I think that's why when I'm like reading a book or I'm listening to something or watching something where, say, someone's being tortured or something horrific's happened because of, through World War II or something else, and they're explaining, this happened and this pain, you kind of cringe about it in thinking, but you don't truly really know what that feeling would be like. I find it interesting that you can't mentally understand what that would feel like.
Yeah, definitely. There's I wanted to get onto doctors treating pain. So
yep,
I think they have there's like a little bit of an ethical dilemma that they experience, whereas like I suppose like the more information they can get, the better. And just a side question, have you ever had painkillers for anything?
No.
Yeah, I can't recall having painkillers for anything. Maybe when I was a kid, but I doubt it. And so I know there's definitely situations where they've had like a patient or whatnot, and the patient's just begging, like absolute begging for painkillers. But the doctor sort of needs to know like where the pain is, how it changes. And, that's one of the bad things that would potentially be about like the most effective painkiller ever. So you just had shoulder surgery and then it just feels fine, feels like a normal shoulder. Well, that's definitely a bad instance because that's where you're going to
go do some push-ups and then wreck your shoulders completely.
Yeah, he'll see one of us two outside doing 1,000 push-ups, be like, me and Mortis, I can do that. I can do that with shoulder surgery.
Yeah, and then gone. But it is an interesting predicament because, in a case, you kind of want them to feel more pain because it's going to help them out in the long run to not injure yourself and not do other dumb things.
Exactly.
That's why I guess probably where I was coming from, where it's better to feel more pain than it is less pain.
Yeah.
Because it actually is good to feel pain. Like, that if you stub your toe, if your shoulder is really bad, you shouldn't be doing certain things because you're going to actually go and tear it or do something even worse to it.
Yeah.
But it's an interesting ethical question for them to whether they push a little bit to letting the patient be in a little bit more pain and be aware that they can't go and do certain things, or kind of giving them those painkillers or something else so that they have a better life, but then, risk the fact that they could go and perhaps think that they're ready to go and play volleyball when they really shouldn't.
Yeah. Here's another interesting one. So I've heard this from Sam Harris a couple of times, which is, I suppose, how your own sensations can change based on the context of it. So you would think that a stubbed toe would still have like the same amount of pain or whatnot. Like the feeling from that would be the same no matter the context in a sense. But he's got a little thought experiment, which is say you awoke one night with the exact same sensations you would have immediately after a gym session. So you're super tired, like your body hurts, your arm hurts, you're breathing heavily.
Yep.
If you experience that while waking up in the night, you would think like, oh my God, what the hell's going on? I'm having a heart attack. I'm having a stroke. Like, this is awful.
Yep.
And so the sensation from that in waking up would be painful and you'd be scared. You'd be scared as hell about that. And you would definitely be suffering from that.
Yeah.
Whereas after a gym session, you're like, woo, feeling good, feeling excellent.
I get that, but I think Sam probably missed... I would say Sam missed something there because the sensation is one thing, but it's got to be tied to like the chemical reactions of it, right? The reason you sometimes feel euphoric post the gym session is with the endorphin release. Right? So even though you're in pain, the endorphin release is good. Where if he's saying the exact same thing when you wake up,
so you'd still have those endorphins,
release,
but
then you'd feel painful, but you'd feel like energized.
Yeah.
But I think the context would be the fact that you didn't train. It's just like, why am I feeling this way when it would feel weird. Like, it'd feel weird. I don't know if it'd feel like you'd be scared.
I think your thinking would override whatever it is that you're experiencing. So that's maybe a context where I guess you can say pain is more linked to the emotional side of it than the actual physical sensations.
Yeah. Well, one thing I was going to say so I do agree though that context definitely changes pain. And so looking back at the scale, right, I think sometimes if you're just like fresh, nothing, like you just wake up and you stub your toe, the pain of it might be a 5 or a 4. Like it'd be like, oh, this is painful. But if you are in a fight, right, you're in a fight, like your body's like charged up, neurologically, like you've got just all these, you got adrenaline pumping through you, you'd probably cut like your toe completely off and just be able to continue going fine. Like you just wouldn't, the pain, the ability for your body to like accept pain there is just much higher and almost like just reduces the scale down completely until afterwards when it's like, oh, okay, there's some pain here that I've got to like register.
Yeah.
Now, I haven't really read much into the whole thing, but it's like the whole, when you say, you know, you've got a pain on one side, just like pinch your leg or something and just refocus your mind to somewhere else where it's a more acute, immediate pain as opposed to like a prolonged pain.
Yeah.
I think it's an interesting concept because could you utilize it in other ways that you currently don't? Like, you know, that the whole thing of, I've remembered, you know, playing soccer and having not like a horrific injury, but just like something that would cause pain, which in the moment you just don't experience at all.
Yeah.
Right.
Yeah.
Almost like should you have on hand like a shot of adrenaline at the ready for everyone to be like, oh, allow you to perform in a better way when you're through pain. Probably extreme, but that's what I guess special forces individuals do. Don't know if police force and fire servicemen do it as well, but you know, when you're like about to die in on the field, or you need to get them like up and moving and your legs have been shut off, they carry adrenaline shots to be like, yep, shot of adrenaline, just get going. Like, you know, feel the pain later, essentially. So it can't help, you know, really extreme scenarios. I'm trying to think if there's an applicable civilian use for them. I don't really think so.
Yeah, that's probably.
But imagine
probably
imagine a sport game, like a rugby game, and everyone's like, don't worry about like steroid use or whatever to make you like bigger or stronger. Just before every game, everyone just gets a shot of adrenaline, just like go for it. I think that would just be so fun to watch.
Yeah,
dangerous to watch.
Maybe not even fun to watch because then people would, you know, perhaps like the skill would go down a bit because everyone's just jacked up and just like trying to grit their way through everything rather than, you know, being skillful about it.
Yeah.
Well, they used to use methamphetamines in war, so to that was like part of the soldiers' rations, a dose of meth.
Wasn't it? That's an equivalent of speed, pretty much, because German pilots.
Yeah,
they were on what?
Well, the soldiers in the front, the stormtroopers and shit. They all had it.
Yeah,
they all had this boost of energy.
Before, because I was going to a couple of techniques and things that you can do to avoid pain and whatnot. But before that, though, I was going to talk to you about. So talking about pain, I just recently watched a movie, 1917, came out last year.
Oh yeah.
I don't know if you're aware of what it is.
You told me before.
A little bit, but in essence, like, you know, looking at the whole movie, which I really enjoyed because while it wasn't done this way, if you paid attention, they try to make it so that it was shot in one shot, like the entire thing was shot in one shot, and it was really, really cool. But in the pain of it, there's a lot of things that this particular individual goes through in the movie where it feels like pain from death, pain from getting shot, like something blowing up on him and all this sort of pain. And he has to compartmentalize it like so well to be able to continue towards something, right? A mission. So I was thinking about it from the perspective, and this will kind of lead into techniques, but just having the ability to because pain is like chemical reaction of, your neurons kind of saying in your brain, hey, there's pain from nerve endings. To be able to compartmentalize really well or control emotions to the point that you can be like, okay, this happened, it's painful, like I just got stabbed, but actually I've got this thing that I've got to go do, which is even more important, really seems to sharpen your mind and go, okay, and dulls down that pain. So might trial into some of these things. So a couple of them. One, deep breathing. So obviously you're not going to sort out, really, really, really big pain that you're about to die. But even if you like cut your leg off, just deep breathing and trying to centralize yourself to not allow your body to go into this over hyperventilating mode is one thing. Two, eliciting the relaxation response. So an antidote to the stress response, which pumps up the heart rate and puts body systems in high alert. The relaxation response turns down your body's reaction. So it was more about almost meditating, just sort of closing your eyes and trying to just like let yourself just slowly just sort of sink into a little bit more relaxed state where, it's essentially stop your heart rate pumping up and getting your blood circulating and all your nerve endings just firing and going like, oh, you need to go. Again, a couple of the other ones were like meditation, mindfulness, yoga and Tai Chi, and positive thinking. So, when we're ill, we often tend to become fixated on what we aren't able to do. So fixating on like, okay, well, this is what I can do and this is the positive things from it. And all of these things I was reading it and I'm like, okay, all of it is like deep breathing, calming yourself down, which, like we were saying, unless you're like a master monk, and even then, you're not going to be able to do that in many places of pain. I would trial something out if it existed. So not a shot of adrenaline, but a shot of something else that was almost like a shot of endorphins or a shot of something else where it like forcefully made your brain be like, no, it's going to be like complete, a creation of just like positive chemical balances where all of a sudden you're like, okay, no, I can be doing this. It feels relaxed. I don't know if there is like a exogenous way morphine, to do that. Well, if it is morphine, potentially, is it a bad thing to have like a shot of morphine when you're feeling those levels of pain?
I think,
or can you become too like dependent on that?
Oh shit!
Which people can get to that point. Yeah.
Well, yeah, I think it's using that when the pain level is more of the emotional pain. And I think that's where you need more of the mental techniques to get rid of it. So say the opioid epidemic in the States, and I think even in Australia we have some, particularly out at the mines, where you have, it's not a pain of physical pain, but it's like the emotional pain of like the metaphysical pain. Why am I here? What are we doing here? Like what's the purpose of my life? That sort of pain.
Yep.
That I think, yeah, if you're trying to treat that with drugs, that's you're going to go down a bad path there. But yeah, and from basically everything you were saying there, the deep breathing, positive thinking, mindfulness, whatever, all of those are just ways of changing your mental state. There's nothing in those like that. All of those are just the same technique of doing something a little bit different mentally. So yeah, that's One thing you didn't mention there was treating pain through bullshit methods.
Bullshit methods. Oh, you've got a couple of those, yes.
But they'll work as well. And this is where it's interesting. So crystals, man. Have you ever used crystals?
I have not. No.
Okay. Well, I haven't either. And
do they work?
I don't think they'd work with me because I think they're bullshit. Yeah. But if I thought they worked, they actually do work. Yeah. And that's the placebo effect. And that's what, all modern medicine... That's why they have those like double blind trials just to make sure if something's working.
It's not the placebo effect.
It's not the placebo. And, that's real interesting because it gets to the source of if you're just someone who can convince people of things, if you can tell a really good story, you can actually solve a whole lot of problems, not through medically tested, provable ways, but just because you can convince people this is going to help you, this is going to make you feel better. So all those videos or things you hear of, the preachers in the church going at it with a sermon, come here, Lord, we give you, boom, smack them in the head.
Cure cancer.
Yeah. And they'll fix that person in the moment.
Yep.
But it's, a week later, are they still feeling that same fix? And
yeah. I get what you're saying.
I could almost certainly believe a story of someone doing that and then they believe that they've just been cured. So their body sort of reacts in a slightly different way. The cancer goes into remission or whatnot, and then they're cured. The preacher
it's kind of saying that the positive thinking is just, it's someone selling you what they believe is real.
Yeah.
But everyone believes it's real. It's not like actually physically happening, but pure through like positive thinking, the changing of your sort of chemical balances can actually end up doing something.
Yeah. So I was sort of hypothetically thinking, so imagine, so there's people out there who will like sell crystals to the end of the earth. Crystals are the best thing. The blue crystal will make you feel this way. The purple crystal, the amethyst, whatever.
Yeah.
And I'm just trying to imagine there was some dude who was so good or some girl who was so good that they could convince you of everything, everyone of everything.
Yeah.
To like alleviate pain. Then they would would that be legit science then when they got to that level?
Yeah. I would say still no, but
Yeah, no,
it's a very interesting concept.
doesn't make sense, but yeah, it's interesting, and it's like, do some people need these things? Is there something particular about the crystals, so they can believe in crystals, but they can't believe in like fungi or mushrooms or dream catchers or whatever the hell? So yeah, that's
It's another one. Yeah, no, good point. Good call out.
It's just real interesting when you start delving into pain, how much of
Or
it
how you can
is-
manage it.
is
And how much-
the mental side of
Yeah,
it.
and how much people are willing to do to try to like alleviate it. Right? So I want to end it on a sadistic note.
Oh, okay.
So, what is your favorite type of pain?
Ooh.
Do you have one?
Let me think of that.
So I'll tell you
You got
mine, which is
something,
easy. Mine's easy, and you might have to copy it because it's a very interesting question. Gym pain, like pain of like a muscular pain. I love it.
Yeah.
And I don't know whether it even sits on a scale. Like, I look at the scaling. The scale seems to be like obviously a negatively affecting one, where it's like, oh, you struggle to do it. However, you know, looking at the scale, I'm like, well, I've been in like a level 3 and 4 pain before, where I can't walk properly because of such a big leg session, or you know, your chest, you can't even put a shirt on because it's like super tight.
Yeah.
But it's in a good sense, right? And like really, you're ripping your muscles, like tearing them apart, building them up. But that sort of pain, for some reason, right, is associated like positively. It's like, yes, I want to do this. This is a good thing. Now, not everyone out there likes that. I know a lot of people who are like, oh, I don't like the soreness from gym, the pain that you kind of feel. For me, it's like, oh no, that's awesome. Now, I don't know if it's all the way to sadistic, but it is like an example of liking pain or enjoying that sort of pain. So
Yeah, because that comes with the knowledge of the effort, the work that went into it, in a sense. Yeah, for me, it would maybe, just to give something a little bit different, that's probably pretty up there. But say something like cleaning out the ears with Q-tips. I'm not exactly sure if that's pleasurable, but or if it's painful, but whatever it is, like I enjoy doing it.
level 0.03 on the pain scale, right here.
Yeah. Or something, you know, even where there's that pleasure in, I don't know if you've seen videos or like even done this, like pimples or something, like popping a pimple. It's painful, but it's sort of like, you know, feels good at the same time as well, because you're getting like, there's something satisfactory in that. So yeah, probably something like that. But no, in general, no, I don't want to be whipped. No, I don't have any crazy sex stuff. Yeah, that's not really up my alley, per se. So I'll take a pass on that.
Deuce, we're gonna whip Deuce. Yeah, I think I'll enjoy that.
Very good, very
Hit
good.
me with now. We're talking about pain. Tell me your painfulness with your
My score.
your score, your fitness journey.
Yeah, it's been lagging the past month, I guess.
I'll give a recap to people. You know, maybe we haven't talked about it too deeply in the past, but you know, again, we set ourselves for a yearly fitness challenge with not just ourselves, but a couple of our friends.
Yeah.
Score. It's out of 100.
Out of 100.
There's I think it was 12.
10 main exercises, and then which were individual to the person, and then the 11th was rowing, which was to everyone.
Yeah.
And it's you and me. The other two.
Yeah, the other two are they're not going to get close. So, you know, we've been pushing, but I think in the last couple of weeks we've been, you know, lacking obviously a lot of things happening. Your finger breaking, you know, break your finger gang. Yeah. So what? No score?
No increase. I'm putting like the amount of work that I can do into it, and yeah, I feel like there's I'm definitely still going to get points before October 14th, I think was when we started.
Yep.
So I'm definitely still going to get points before then. It's just how much, because there's some stuff I'm not doing. I'm not doing the deadlifts. I'm not doing the rowing. I'm not doing the squats.
Yeah.
So we'll see. One thing I do want to congratulate myself on was, I didn't mention this last week, but I did do the 1,000 push-up challenge.
Yes.
We did that 2 months ago now, something like that. And I failed it first time. I only got 850, I believe, in an hour.
Yep.
And I finished it like 1,000, but it took me an hour and 18. This time I trained for it a bit more, and I had a schedule set up for it, like a routine, a system. And I managed to do 1,057. So an increase of 157.
Nice.
So I'm very happy with myself for that.
Good. Good. I fortunately didn't have to do it again since I'd already completed in the first go.
Yep.
But I'll just pat my own back for that.
Yeah.
For me, points. I don't know if I called it last week, but I did get the my final pull-up points. So that's,
you called it, but you couldn't remember what
score I was on.
Yeah.
I think it was 49 now. So I think it's
Okay.
49. Still haven't cracked the 50 I think you're on 51. If I recall correctly, looking at the
something like that.
spreadsheet. So, anyways, we're still halfway there to what we think.
Yeah.
I'm still, if I can even get to 70, I'm going to be highly impressed.
I'd be pretty happy with 70. I think.
So, anywho, ladies and gentlemen, thank you for listening in. Karen, where can we find more Mere Mortal content?
Go to the YouTube channel if you're listening via audio and you want to see what we look like, see some little bit more interaction in the body
Some
stuff.
color.
Yeah, we got a little Rubik's Cube in front of us here and other little knickknacks. YouTube, I think, is where we put the most effort. So if you want to get the most enjoyment,
Bang for your buck, YouTube.
yeah, is that. But if you're on any of the other social platforms, we're there. So jump on, find us in there. Mere Mortals, black logo, 2 M's, do it.
Easy to find. That is all from now. One out.
Karen out.